All right, who's ready for a little healthcare debate? Just got done watching a video where somebody on CNN was claiming that you could go overseas and get better medical treatment for less. And I'll pretend for a second that it is absolutely true. And I will also fully admit that the current system, the so-called private insurance that we have, and I use quotes with my hands if you could see that quite heavily, because we'll describe that what we have really isn't insurance. Um, in some of the examples of that CNN video, people said that they paid zero. When in fact they didn't pay zero. They paid for it in so many other ways. They just didn't see it. They paid for it in the airline ticket that they had VAT added to it when they were going there. They paid for it in the coffee that they purchased, the wine they purchased, the food they purchased, the hotel they stayed at. They pay a 15 to 20% premium on all those goods and services in order to get that free, quote, zero cost health care. Same thing that's actually happening here with the private insurance industry, and that is the certain feeling of entitlement that says if I pay for insurance, I must receive something. The incentive to go to to go to the doctor, and I'll just say this, that it's higher than ever. And why is it higher than ever? Because we feel entitled to go to the doctor and pay zero. If instead I am allowed to make the calculated decision of if I go to the doctor, I will have to pay $100 out of my pocket that day in order to go to the doctor. There's a good chance that I'm not going to go for the stupid stuff like a cold, a sinus infection, something like that. The other thing to keep in mind is that many of these medicines that are found at your local pharmacy, whether it's Target, Walmart, CVS, Walgreens, whatever, cost $4 or $10 for 3 months worth, but you have to go to the doctor and spend $120 in order to get those meds. A majority of the population is not going to abuse penicillin. The majority of the population is not going to abuse acetaminophen. The majority of the population is not going to abuse a lot of these over-the-counter, I'll say, $4 drugs. But you're still required by law to go get a prescription from a doctor who's charging you $120. And so what happens? You go to the doctor, you spend 10 minutes with them, you know exactly what you need, they know exactly what you need, so you pay for them to really write the prescription down on the pad so that you can legally get it. So what have we learned? It's not the actual insurance, it's not the people, it's the government regulation that says it is illegal to give a prescription for penicillin or for acetaminophen or for what other type of prescription drug there is out there unless they have a doctor's prescription. And so what that does is artificially raise the demand for a doctor. His skill is not to give out generic prescription drugs to people. His skill is to be able to diagnose complex diseases and diseases that would not be curable without having the diagnostics of an 8-year plus medical school, learning about all aspects of the human body. If I can look at you and be able to diagnose with 99% certainty that, oh, you have a cold, there's nothing I can do for you, sir. If the doctor's free, I'm certainly going to go. If the doctor costs me $100, there's a good chance that I'm not going to. And what does that do? It decreases the demand, and it'll decrease the pricing of our doctors. Right now, the whole reason pricing continues to escalate is because people are going for stupid reasons. People have the fear that they need to go and get their swine flu shot. They need to go and get this flu shot. They need to go and get this vaccine, that vaccine. And what that's doing is cutting off and choking the limited supply of doctors and nurses and practitioners out there. And as a result, the pricing has to go up. It's a basic supply and demand concept. In the concept of single-payer system, or we'll say universal free, quote, health care, the money still has to come from somewhere. The demand is going to be higher than ever. And what you're going to see is in countries like Canada, there's a 3-month wait for a simple physical. In speaking with most people up there, even in the private sector, they end up having to wait basically 6 hours to get into a doctor appointment.